Hi, this is George Bekmezian, and I'm back with another rational nugget for you. Are you interested in answers to the following questions? Do children contract SARS-CoV-2? Can they develop COVID-19? Are masks effective at stopping the spread of the virus? These are among the questions that I will answer in this episode. The primary material for this episode is the report released by the CDC on September 11th titled Transmission Dynamics of COVID-19 Outbreaks Associated with Childcare Facilities. Before I get into those questions, I want to tell you that I signed up for contact tracing training way back on May 14th because I wanted to better understand exactly what contact tracing is and what contact tracers are being taught. I finally made the time to complete that training this last week and am now officially certified for COVID-19 contact tracing. What that means is that I can probably answer most of the questions you may have about contact tracing. So go ahead and comment below if you have any questions. Also, as usual, I will include links to all references used in this episode in the comment section below. Now, back to the CDC report. As is often the case, the media uses this report to fuel the panic porn. But I found something quite interesting as I read through this report, and I want to share that with you. The too long didn't watch summary is this. Children in the study develop mild symptoms or no symptoms at all. Children can spread the virus, like that is a surprise. The facilities that require adults to wear masks didn't fare any better than the facilities that didn't require masks to be worn. Finally, even the CDC acknowledges masks are generally ineffective and contact tracers are instructed to treat mask-wearing contacts no different than non-mask-wearing contacts. If you stop watching here, I want to leave you with the following thoughts. You have every reason to be hopeful. Mortality rates are continuing to go down. Hospital utilization rates continue to be low. There is no reason to live in fear. Now, let's dive into the data. According to the report itself, the report was produced to better understand the transmission of SARS-CoV-2 from young children. Contact tracing data collected from 3 COVID-19 outbreaks in child care facilities in Salt Lake County, Utah between April 1 and July 10, 2020 was retrospectively reviewed to explore attack rates and transmission patterns. There were 17 child care facilities that met the study's criteria. The only criteria for facility to be included in the study is that it had to have had at least 2 cases during the study period. That seems like a very low threshold to me. Are 2 cases really considered an outbreak? The report describes outbreaks from 3 of those 17 facilities. They don't explain how they decided which 3 to focus on in the report. I'll paraphrase the purpose of the report so we are all clear. They wanted to understand how or if young children spread SARS-CoV-2. In case you are wondering about how the children fared, there were no surprises. Among pediatric patients with facility-associated confirmed COVID-19, all had mild or, you probably guessed it, no symptoms. Great news, right? Of course. And exactly what we would expect considering what we know about this virus. The report reveals the following nuggets. Of the 12 children that allegedly acquired COVID-19 in a childcare facility, 3 were asymptomatic. It also says, quote, transmission was observed from 2 of 3 children with confirmed asymptomatic COVID-19. Detailed contact tracing data show that children can play a role in transmission from childcare settings to household contacts. Sure, children, adults, anyone carrying the virus can potentially spread the virus. We don't dispute that age-old knowledge. That's how germs work. Interestingly, 58% of the contacts, and a contact is defined as someone who has been exposed to a COVID-19 positive individual for at least 15 minutes. So, 58% of those exposures, which were identified through contact tracing, were either asymptomatic or didn't have COVID-19. The first facility, which we will refer to as Facility A, required only staff members to wear face masks. One staff member came to work with symptoms on April 2nd, and another staff member contracted the virus and developed COVID-19, presumably, from the original staff member. According to the report, there were a total of 3 staff members, and the index, or original case, was responsible for spreading the virus to 1 coworker. That means a 50%, 1 out of 2, infection rate among staff. The facility attack rate, excluding the primary case for Facility A, was 17%. That's 2 of 12. So, 1 adult and 1 child at Facility A contracted COVID-19, and again, the facility attack rate was 17%. The second facility, Facility B, also required face masks to be worn by staff members. Apparently, there was a total of 3 adults and 2 children at this facility. The report states the facility attack rate for Facility B was 100%, 5 of 5. I want to emphasize face masks were required to be worn by staff members at Facility B. Finally, the third facility, Facility C, did not require masks to be worn by either staff or children. This is the facility that had the mother who was hospitalized. The report states the mother, quote, was presumably infected by her asymptomatic child. I mean, maybe she was, but maybe she was infected by a staff member or some other contact she may have been exposed to. Since the report doesn't provide any details, we have no choice but to trust the researchers. The facility attack rate for this facility, remember, there were no mask mandates at this facility. The facility attack rate for Facility C was 18%. That's 15 of 84. The report goes on to discuss how many contacts infected children spread the virus to. In summary, the report states, in these 3 outbreaks, 54% of the cases linked to the facilities occurred in children. Transmission likely occurred from children with confirmed COVID-19 in a childcare facility to 25% of their non-facility contacts. So, this highly contagious, novel virus only infected 25% of the non-facility contacts. And then they conclude, mitigation strategies should have helped limit SARS-CoV-2 transmission in these facilities. Wait, what mitigation strategies are they referring to? Here's what they write. To help control the spread of COVID-19, the use of masks is recommended. They are recommending masks. However, there is no evidence in these 3 outbreaks that masks being worn by the primary cases made any difference when compared to the facility without any mask mandates. The report also concluded that an 8-month-old transmitted SARS-CoV-2 to both parents. Again, how they reached that conclusion isn't detailed. One has to assume that a parent would have gone into the child care facility to drop off the 8-month-old. Is there a possibility the virus was transmitted to a parent then? One would think. Let me read what I have learned through the contact tracing course I took, which I referenced earlier in this video. According to the CDC, while research indicates masks may help those who are infected from spreading the infection, there is less information regarding whether masks offer any protection for a contact exposed to a symptomatic or asymptomatic patient. Therefore, the determination of close contact should be made irrespective of whether the person with COVID-19 or the contact was wearing a mask. According to the CDC, the research shows wearing a mask may or may not prevent you from spreading the virus. And there is even less information to support the idea that wearing a mask can prevent you from getting the virus. Basically, we don't know if masks are doing anything at all, but we are going to encourage mandating mask wearing universally, and then we will treat you as if you weren't wearing a mask when we do contact tracing. Although this report was intended to be an exercise to learn about children spreading SARS-CoV-2, it reveals some interesting things. A, there is a clear agenda here since the recommendation to mask doesn't make sense given the content of the report. B, the CDC is releasing content to perpetuate fear and anxiety. Why would they keep doing this? C, the media is happy to spread the fear and anxiety without doing their own critical analysis of the data. Thanks for watching. I hope you found this episode beneficial. Please subscribe, comment, share, all that good stuff. See you later. I'm